When Full Circle Adoptions evaluates an adoption case, a potential adoption case, we listen for a number of very important themes. One of them is legal safety. We want to know that the biological father or any and all possible biological fathers have been identified to the extent possible so that we can get health history and so that we can inquire about what their interests are with respect to the expected child. We want to gather prenatal medical history. We want to get the expectant parent's self-report health history. We want to ask about Native American heritage for reasons I can go into in greater depth. And we want to listen for their motivation as to why they're considering an adoption plan and whether those circumstances are likely to be enduring ones that might be a stronger reason for them to consider adoption. When we ask these and other questions, sometimes there will be a factor or more than one factor that we can anticipate prospective adoptive parents might say, I wonder if I would want to be considered for that case. So, for example, if expectant parents report that in their family history there's some mental health issues, maybe a grandparent had bipolar disorder, or let's say the expectant parent themselves report that they had 5 beers each of Friday and Saturday night for the first month of weekends that they were pregnant. There could be a number of different reasons why some families would be open to being considered and other families would say, well, maybe not in this particular case, but thank you very much. So what we do is we send all of our prospective adoptive families who could fit the criteria established by the expectant parents an email, and it will say in the subject line, pre-screening. And in that pre-screening email, we say, we're working on a case. Here's some information. The expectant parents have not looked at your profile yet, and we would like to ask you, would you like to be considered? At the point that we're asking you this, we have actually, at that point, usually done a fair amount of work. And it is not uncommon for expectant parents to call us initially in a crisis mode. The putative father might have left them, they might have lost their job, they might have other enduring circumstances that are more chronic, and they're very interested in knowing whether or not the agency can help them with an adoption plan. They might be interested in knowing whether the agency can help them with pregnancy-related living expenses. And very often they're very interested in knowing, if I maintain this pregnancy, will there be an adoptive family who I will feel good about and with whom I'd want to place my child. So they usually are calling with some degree of pressure or interest in getting their questions answered. We are in the position of saying, we understand that all those questions are pressing, and in order to answer your questions, we need to lay a foundation of gathering some information, and that information will include your health history, do a financial needs assessment, talk with you and the putative father about your interests and your thoughts about adoption and parenting both. And so by the time we've gathered the self-report medical history and the medical records and done some initial counseling for the expectant parents, they're usually very eager to move on to the next step. So when we send the pre-screening email, we ask that you get back to us very promptly so that we don't frustrate her needlessly or frustrate him needlessly. And so for that reason, we always ask you to have a set of experts available to you for consultation. And I'll have a little video clip about experts that we recommend in a moment. So you would consult with your experts and try to make yourself available to do this kind of a review of pre-screening a possible situation with very, very close timing. We appreciate it, and it's all with the interest of trying to make sure to meet both your needs and the needs of the expectant parents. So that's pre-screening potential situations.